Now we will move on to the next topic, OPD and OT theater designing. OPD is the first place where the patient comes in contact with the hospital and it presents an image of the hospital. Likewise, the OT is said to be the heart of the hospital. So it is imperative for both these two areas should to be scientifically designed so that we can make the maximum utilization of the space. We can maintain them easily, and it is also important for infection control. So I would like Dr. NILUTPAL BORAH to please speak on OPD and Operation Theatre complex designs.
So, we're talking on OPD and Operation Theatre and complex design. So, at the outset, I'd like you to remember that we are discussing a hospital in an underprivileged area. So, still we need to have a good hospital design so that it reduces patient recovery time. Also, hospitals are built around patient and their families. That is the total focus of a hospital. So there are guidelines, NABS guidelines, which was established for quality control of India it's a quality control of India establishment, and it helps to establish an operation accreditation program for healthcare organizations so that it can function at a certain standard. However, designing a hospital according to NABS guideline is pretty difficult. It requires to interpret the guidelines, and it has to be conveyed to the manager, it has to be conveyed to the team, and at an extreme level of detail, which may be very difficult to manage in a small center. Location is one of the most important things for a center. Location should be easily accessible. It ideally should be 2-3 story building. Generally, underprivileged areas, generally you have small buildings, so that is appropriate. Space can be 2,000 square feet, it can be 15,000 square feet, but generally an hospital in underprivileged areas borders around 5,000 to 6,000 square feet. So in that area, we have to play, and space has to be utilized in a maximum way. Ventilation is an important factor, and first we have to, while designing the hospital, we have to think about the OT, because that is the heart of the hospital, and these OTs can be customized. So it need not be a particular of a size which is recommended by NABS, so we'll discuss later. So, but however, you have to keep in mind that we might be having 2 OTs or 1 OT now, which we may have to extend up to a third OT in the course of time. So we have to have some space for expansion. There are many kinds of designs, and which can be had from an architect, or which can be modified from a internet design, or we can follow some of the NABS guidelines also. So it takes a longer time, and however, we have to remember that the OT should be in a part where there is less movement of the personnels. There are different zones described in the OT complex. There are basically 4 designs. So it should facilitate location and full flow of the patient, staff, also the materials, also the disposables should be easily disposed. And there are 4 designs, 4 zones which are described based on varying degree of cleanliness, the bacteriological count, which progressively diminishes from the outer to the inner zones, and is maintained by differential positive pressure ventilation gradient from the inner zone to the outer zone, so that the microorganisms, if present, can be taken away from the OT to the peripheral zones. Protective zone includes change rooms for medical and paramedical staff, transfer bay for patients, material and equipment, rooms for administrative staff, stores and records, which is very important, pre and post-operative rooms or recovery rooms, because we don't need to keep patient in the hospital, only daycare centers we're talking about. So still for recovery for 2-3 hours, we have to have a couple of beds, or maybe 4 or 5 beds for early recovery of this patient, especially the elderly, and sterile stores. Clean zone connects the protective zone to aseptic zone, and has stores and cleaning room, equipment storeroom, maintenance workshop, or emergency exits in case of any emergency or fire or earthquake or whatever. Aseptic zone includes operation room, which is the heart of the hospital, and disposal zone, where there is disposal areas from the OTs, and which there should be ideally corridor which leads to disposal zone. An operation room ideal size, like I told you, 21 feet by 21 feet, but height should be approximately 10 feet. However, it can be slightly lesser of a lesser size, but it should accommodate all the instruments, and it should facilitate the movement, easy movement of the person, 4 or 5 persons in the OT at a time. Main door has to be wide enough, approximately 4.5 to 5 feet, and it should be of a sliding door if possible, because there is no air disturbance. Surface and flooring should be slip resistant. It should be strong. If something falls down, a gas cylinder falls down, it should not break. Impervious with minimum joints, and jointless tiles are easy to clean. Walls maybe of tiles, or maybe we can use usually special plastic enamel paints, which are relatively cheaper, and which are seamless, and it also allows for chemical cleaning when required. And color should be soothing to the eye. And ceiling can be made with the plasterboard or special metal, and it should be airtight, and it also needs to be cleaned with chemicals, so it should be cleanable. Operation table in part theater should be 1 ideally. And electric points, we have to remember that it has to be approximately 4 to 5 feet height from the floor, and there has to be a scrub area for at least 2 to 3 persons in each OT. And proper drainage system is very essential. Otherwise, it will be difficult to clean the OT, because every week or every other operation with an infected case, so it will be difficult if you do not have a proper drainage system. Safety is essential, and fire extinguishers have to be planned in appropriate zone. Ventilation, direction of airflow should be from the OT towards the main entrance, and efficient ventilation can be had, or we need to may have HEPA filter also. However, this is not always necessary. Even AIOC's guideline also says the HEPA filter is not always necessary for small hospitals. And AC system can be recirculating system can be expensive, and it exchanges airs and takes out the polluted air from the OT. And circulating system, which is more available in the OTs, small hospitals, so it recirculates the air, but doesn't take out the polluted air from the OT to outside. Electrical equipments we should choose which are of best quality, because they are fire hazards. We shouldn't use, we need to have enough plugs. We shouldn't use multi-plugs, because sometimes there may be spark and there may be emergencies inside the OT. And load circulation has to be calculated with if we have an electrical engineer, it is fine. Otherwise, we need to discuss with the electrician. And emergency power backup should be always there in form of inverter, the UPS, or a generator is very necessary in underprivileged areas, because their power supply is very erratic. Operating microscope should be backed up by a battery backup in case of power failure during surgery. Suggested time can be 1 to 2 hours, which is sufficient enough to even finish off most of the retinal operation as well. Lighting should be generally nowadays LED lights are used, which are although slightly expensive, but they are easy to maintain, and they last for a very long time. And there should be sufficient light, but the light should not be that much that it should blind your eyes. So I mean, it shouldn't hurt your eyes rather. So there should be sufficient light in the OT. And OT should also should be in such a way, the instruments should be kept in such a way, especially in tables with wheels, so that it can be easily cleaned weekly or every day, whatever way you want to do it. And also we need to have ventilators and multi-para monitors in case of emergency. Sterilization protocols should be strict, and biomedical waste should be disposed. Nowadays, in small municipalities, there is pollution control board collects the waste, so it is easy to, if we sign an agreement with them. And look after the administration as well. Communication has to be there from the OT to the outside, to the reception, to the anesthesiologist. Camera as a monitor if we are going to record, because nowadays record is very essential for communication with the other colleagues or students, or maybe for the patients also sometimes, or for medical legal reasons also. We can have cameras installed in the microscope. Data management is very essential. Whatever we do in the OT, whatever you use, that has to be recorded, and if possible, it has to be recorded in a computer. And software can be had from the professional sailors. However, that is very expensive, so we can adapt and make software for OT management, or as well as hospital management from a local provider. Outpatient department should be aesthetic. It should be open. Ideally, there should be light from outside, and we can put some artworks or sound music to soothe the nerves. A better waiting area relaxes the patient, and the patient, if he or she has to wait for a couple of hours, they generally doesn't disturb you. A pleasant clinical environment also helps you to work efficiently. Respiration should be approximately 100 square feet, and 60% area should be waiting for waiting and corridors. And consultant room should be ideally 150 square feet, or you can also make it 100 square feet. But if you go beyond lower than that, it becomes slightly crowded. You can also build other rooms like treatment rooms, diagnosis rooms, and other rooms that can make patients comfortable. And a bed, ideally center to center distance should be 8 feet, which is one important thing I'd like to highlight, that unlike the cities, bigger cities or metros, in the rural underprivileged areas, it is slightly easier to have more square feet areas for a project like this. Minimum energy expenditure can be had with use of LED light. And we have to have ease of entry into the hospital and ease of going out from the hospital of the elderly patient, because most of the eye patients do not come with eye ailments. So ease of entry into the hospital and exit should be very essential. We can get drink machines, water filters for the patients, and we should follow all the statutory regulations like municipal corporation, government, pollution control board, fire safety department, water supply, etc. We must follow it, and we have to have licenses for this. In the era of evidence-based medicine, give maximum importance to planning of an OT and OPD. Generally, complications occur very less. However, if they do happen, so it can give you lots of trouble. So we need to plan accordingly before, while setting up a new setup. Within the limitation of finance and space, best results can be obtained, and an anesthesiologist can be a very good friend, because they have a lot of idea and they have training to how to setting up an operation theater, especially. Efforts should be made to conform to the standards laid down by the local bodies and international agencies, because then it is easier later on if you apply for funds, then they definitely would come and visit your hospital and to like to see how you have set up. OTs hospitals being established cannot be expected to fulfill all the theoretical requirements, as new ideas are constantly being developed. So that is not to say that we should not stick to the our guidelines. However, we have to be careful how much we modify. Thank you very much.
Thank you, Dr. Borah, for the detailed description. And that was